Welcome to this comprehensive presentation on fatty liver disease, presented by Dr. Mohan. This session will explore one of the most prevalent yet often overlooked health concerns, providing key insights into its causes, progression, and management. Let's begin. What is fatty liver disease? Imagine your liver, a powerful organ that works tirelessly to keep you healthy. But what happens when it starts accumulating too much fat? Fatty liver disease is a condition where excess fat builds up in liver cells, potentially leading to serious complications. It's more common than you think, but the good news? It's reversible. The spectrum of fatty liver disease. Fatty liver isn't just one condition. It exists on a spectrum. Some people may have simple fat accumulation with no major harm, while others may develop inflammation, scarring, and even liver failure. Understanding where you stand on this spectrum is crucial for taking the right steps toward healing. Global epidemiology of fatty liver disease. Did you know that 1 in 4 people around the world has fatty liver disease? That's right. With obesity and lifestyle-related diseases on the rise, this silent epidemic is spreading fast. Countries with high processed food consumption and sedentary lifestyles are seeing alarming rates of this condition. Epidemiology in the United States. In the U.S. alone, around 100 million people are affected by NAFLD. But did you know that some ethnic groups are more vulnerable than others? Studies show that Hispanic Americans have the highest prevalence, while African Americans have the lowest. Why? Genetics, diet, and lifestyle all play a role. Epidemiology in India. In India, the numbers are climbing too. With urbanization, fast food culture, and rising obesity rates, NAFLD is becoming a major public health concern. Shockingly, even lean individuals with traditional diets are being diagnosed. The message is clear. Fatty liver isn't just about being overweight. Rising global burden of NAFLD. Let's talk numbers. 1.16 million deaths annually from liver cirrhosis, billions of dollars in healthcare costs, and a tenfold economic burden by 2025. Fatty liver disease is no longer just a personal health issue. It's a global crisis demanding urgent attention. Risk factors for alcoholic liver disease. We all know alcohol affects the liver, but how much is too much? For women, more than 1 drink a day, and for men, more than 2, can start damaging liver cells. But it's not just about quantity. Binge drinking, genetic predisposition, and even smoking can accelerate the damage. Risk factors for NAFLD. You don't have to be a heavy drinker to have liver disease. Obesity, diabetes, high blood pressure, and even genetics can lead to non-alcoholic fatty liver disease. Insulin resistance, in particular, is a major driver. Your body's inability to regulate blood sugar properly can fuel fat buildup in the liver. How does alcohol damage the liver? Alcohol may feel like a relaxant, but inside your body, it's a toxin. As your liver breaks it down, harmful byproducts like acetaldehyde and reactive oxygen species are produced. These toxins trigger inflammation, promote fat storage, and scar the liver over time. The more alcohol you consume, the harder your liver has to work, until it can't anymore. Pathogenesis of NAFLD. So, what actually causes NAFLD at the cellular level? It all starts with an energy imbalance. Too many calories coming in, not enough being burned. Over time, this leads to insulin resistance, toxic fat accumulation, and even changes in your gut microbiome. It's a complex process, but one that we can influence with the right lifestyle changes. The multiple hit hypothesis. Fatty liver disease isn't caused by just one thing, it's a combination of factors. Insulin resistance, inflammation, genetics, and even gut bacteria all play a role. That's why a single pill won't cure it. Addressing multiple aspects of health is key to reversing the damage. The role of gut microbiome in fatty liver. Your gut and your liver are closely connected. A balanced gut microbiome helps digest food and regulate metabolism. But an unhealthy one? It can cause a leaky gut, allowing toxins into your bloodstream and triggering liver inflammation. Probiotics and fiber-rich foods can be powerful allies in healing your liver. Clinical features of fatty liver disease. Here's the tricky part. Fatty liver disease is often silent. Most people don't feel sick until the damage is severe. Some may experience fatigue, mild discomfort, or bloating. But these symptoms are easy to overlook. That's why regular checkups and early detection are so important. 10 warning signs. Your liver is toxic. Your liver may be struggling and you might not even know it. Persistent fatigue, yellowing skin, bloating, nausea, itchy skin, and dark urine. These are just some of the warning signs of a toxic liver. If you notice multiple symptoms, don't ignore them. Your liver is crying out for help. Dark urine. Have you noticed your urine getting darker, almost like tea or cola? This could be a sign that your liver isn't filtering toxins properly. When bile builds up in the bloodstream instead of being processed by the liver, it can darken your urine. It's your body's way of telling you, something's not right. Confusion or mental fog. Ever feel like your brain is in a fog, struggling to focus, forgetting things easily? That's not just stress. It could be your liver. When toxins aren't properly filtered, they can affect brain function, leading to something called hepatic encephalopathy. Your liver and brain are more connected than you think. How is fatty liver disease diagnosed? You might be wondering, if fatty liver disease has no obvious symptoms, how do we catch it? Doctors rely on a combination of medical history, physical exams, blood tests, and imaging studies like ultrasounds. In some cases, a liver biopsy is needed to determine the extent of damage. The sooner it's detected, the better your chances of reversing it. Non-invasive assessment of fatty liver. Good news! You don't always need a painful biopsy to check your liver health. Non-invasive tests like FibroScan, MRI, and special blood tests can assess liver fat and stiffness. These tests are making early detection easier and more accessible for everyone. Understanding liver enzymes. Your blood work can tell a lot about your liver's health. Elevated ALT, AST, and GGT levels may indicate liver damage. But what do these numbers mean? Simply put, when liver cells are stressed or dying, they release these enzymes into your bloodstream. Keeping an eye on these levels can help track liver function and disease progression. Natural history of NAFLD. What happens if fatty liver disease is left untreated? It starts as simple fat accumulation, but over time, inflammation and scarring can set in, leading to serious complications like cirrhosis and even liver cancer. But here's the hopeful part. If caught early, lifestyle changes can stop and even reverse the disease. Complications of fatty liver disease. A fatty liver today could mean a failing liver tomorrow. Without intervention, the condition can progress to fibrosis, cirrhosis, and even liver failure. But that's not all. Fatty liver disease also increases your risk of heart disease, diabetes, and other metabolic disorders. It's not just a liver problem, it's a whole body issue. Treatment overview. For fatty liver disease. So, can fatty liver disease be cured? The short answer, yes, but not with a magic pill. The most effective treatment is lifestyle change. Weight loss, balanced nutrition, exercise, and managing metabolic conditions like diabetes. Small changes can lead to big improvements in liver health. Weight loss. Goals for NAFLD treatment. If you have fatty liver, losing weight isn't just about looking good. It's about saving your liver. Research shows that losing just 5 to 10% of your body weight can dramatically reduce liver fat and inflammation. The key? Sustainable weight loss. Crash diets don't work, but steady progress does. Exercise recommendations for fatty liver. Did you know that exercise can reduce liver fat even without weight loss? Aerobic exercises like brisk walking, cycling, or swimming for 30 minutes a day can make a big difference. Strength training also helps by improving insulin sensitivity. The goal isn't just to burn calories, it's to heal your liver. Dietary approaches for fatty liver. Your diet can either heal your liver or harm it. Processed foods, sugary drinks, and refined carbs? Bad news. But the Mediterranean diet, rich in olive oil, fish, nuts, and vegetables, has been shown to improve liver health. It's not about eating less, it's about eating right. Top 10 superfoods that can heal fatty liver. Some foods are like medicine for your liver. Olive oil, fatty fish, walnuts, berries, and leafy greens all have powerful anti-inflammatory and detoxifying properties. Adding these to your diet isn't just good for your liver, it's good for your whole body. Garlic isn't just for flavor, it's a natural liver protector. Packed with antioxidants and anti-inflammatory compounds, garlic helps activate liver enzymes that flush out toxins. Eating just a clove or two daily can support your liver's healing process. Cruciferous vegetables. Broccoli, Brussels sprouts, and cauliflower. These aren't just side dishes, they're liver detox powerhouses. They help produce enzymes that cleanse the liver and reduce fat accumulation. Want to give your liver a boost? Load up on these greens. Top 10 foods to detox your liver. Forget detox teas. Your liver naturally detoxifies itself if you support it with the right foods. Lemon water, beets, avocados, apples, and green tea are just a few that enhance liver function. The best detox? A healthy lifestyle. Your liver is constantly working to filter out toxins, but are you giving it the support it needs? Certain foods, like leafy greens, citrus fruits, and cruciferous vegetables, can supercharge your liver's detox processes. The best cleanse isn't a juice fast, it's eating the right foods every day. Beets are a natural powerhouse for your liver. Packed with betaine and antioxidants, they help your liver break down toxins and reduce inflammation. Drinking beet juice or adding them to your meals can be a simple yet effective way to support your liver's healing. Artichokes might not be your first choice at the grocery store, but they should be. They help increase bile production, which aids digestion and toxin removal. They're rich in silymarin, a compound known for protecting liver cells and supporting regeneration. Foods to avoid with fatty liver. You can't heal your liver if you're constantly overloading it with harmful foods. Sugary drinks, fried foods, refined carbs, and trans fats fuel liver fat and inflammation. Cutting them out, or at least reducing them, will make a huge difference in your liver's health. Fastest way to reverse fatty liver. Reversing fatty liver is possible, and the fastest way is through consistent, healthy habits. Losing weight, eliminating sugar, increasing exercise, and avoiding alcohol can dramatically improve your liver function in just a few months. Your liver is resilient. It just needs the right care. How to reverse fatty liver disease. Think of your liver as a machine. It needs the right fuel to run efficiently. A Mediterranean diet, regular exercise, proper hydration, and managing diabetes are all crucial. Every step you take toward a healthier lifestyle is a step toward a healthier liver. Medical treatments for NAFLD. There's no magic pill for fatty liver, but some medical treatments can help. Vitamin E, pioglitazone, and certain GLP-1 receptor agonists have shown promise in reducing inflammation and fat buildup. However, no treatment is more powerful than a healthy lifestyle. Fasting and time-restricted eating for fatty liver. Imagine giving your liver a break, a chance to heal and reset. That's what intermittent fasting does. Whether it's the 16/8 method or alternate day fasting, research shows fasting reduces liver fat, improves insulin sensitivity, and enhances cellular repair. Timing your meals might be just as important as what you eat. Probiotics and prebiotics for liver health. Your gut and liver are best friends. What happens in one affects the other. Probiotics, or good bacteria, and prebiotics, or fiber-rich foods, help restore balance, reducing inflammation and supporting liver detoxification. Fermented foods like yogurt, kimchi, and sauerkraut can make a world of difference. Emerging therapies. For NASH, science is catching up. New treatments for NASH, or non-alcoholic steatohepatitis, include FXR agonists, SGLT2 inhibitors, and thyroid hormone receptor agonists. These drugs are in clinical trials, offering hope for people with advanced liver disease. The future of fatty liver treatment is brighter than ever. Surgical options for NAFLD. For some people with severe obesity and fatty liver, bariatric surgery can be life-changing. It helps with rapid weight loss and can lead to dramatic improvements in liver health. However, it's not a quick fix. Lifestyle changes are still essential for long-term success. Monitoring fatty liver disease. Reversing fatty liver isn't just about starting healthy habits, it's about maintaining them. Regular checkups, liver enzyme tests, and ultrasounds help track progress. Celebrate your wins, and if things aren't improving, adjust your strategy. Your liver's health is in your hands. Special considerations, NAFLD. In children. Did you know that fatty liver disease is rising in children? The increase in childhood obesity means more kids are developing liver fat buildup at an early age. The solution? Healthy eating, more movement, and reducing sugar intake. Habits that benefit the whole family. NAFLD in lean individuals. You don't have to be overweight to have fatty liver. Lean NAFLD is common in certain ethnic groups and people with high sugar intake, poor muscle mass, or genetic risk factors. Being thin doesn't always mean being healthy. It's about what's happening inside your body. NAFLD and diabetes. If you have type 2 diabetes, you're at a higher risk of developing fatty liver. The connection? Insulin resistance. When your body struggles to process sugar, excess fat builds up in the liver. That's why managing blood sugar levels also protects your liver. Alcohol use and fatty liver. Alcohol and fatty liver don't mix well. Even moderate drinking can accelerate liver damage, especially if you already have metabolic risk factors. If you have NAFLD, the safest choice is complete abstinence or extreme moderation, because every sip matters. Fatty liver disease and cardiovascular risk. Here's a shocking fact. Fatty liver disease isn't just about the liver. It's one of the biggest risk factors for heart disease. In fact, cardiovascular disease is the leading cause of death in people with NAFLD. Taking care of your liver also protects your heart. The role of genetics in fatty liver. Genetics can increase your risk of fatty liver, but it doesn't mean you're doomed. Variants like PNPLA3, TM6, SF2, and MB87 play a role, but lifestyle choices still matter more. You can outsmart your genes with the right diet, exercise, and habits. The gut-liver axis. Your gut and liver are deeply connected. An unhealthy gut microbiome can lead to leaky gut, allowing toxins to enter your bloodstream and inflame your liver. Keeping your gut healthy with fiber, probiotics, and fermented foods can be a game changer for liver health. Environmental factors in fatty liver. It's not just food. Pollution, chemicals, and plastics can also contribute to fatty liver disease. Endocrine disruptors like bisphenol A or BPA in plastics and air pollution have been linked to liver dysfunction. Being mindful of your environment is just as important as watching what you eat. Future directions in fatty liver research. The future of fatty liver treatment is bright. Researchers are working on advanced diagnostic tools, personalized medicine, and even microbiome-based therapies. Soon, we may have non-invasive tests that replace liver biopsies and medications that target fatty liver at its root cause. Science is evolving. So is hope. Medications associated with fatty liver. Some medications may unintentionally harm your liver. Corticosteroids, certain antidepressants, and even some heart medications can contribute to fat buildup and liver inflammation. Always consult your doctor before starting or stopping any medication. Your liver's health depends on it. Fatty liver in pregnancy. Pregnancy is a time of major hormonal changes, and for some women, it can affect liver function. While mild fat accumulation is normal, conditions like acute fatty liver of pregnancy or AFLP can be life-threatening. If you're expecting, regular liver health checkups are crucial. Cost burden of fatty liver disease. Fatty liver disease isn't just a health crisis, it's an economic one too. The global cost of NAFLD is soaring, with billions spent on treatments, hospitalizations, and transplants. Investing in prevention today can save lives and money in the future. Now let's test your knowledge. Try to answer the MCQs on this topic. Which of the following is not a risk factor for NAFLD? Answer: D. Low body weight. While lean NAFLD exists, low body weight is generally protective against fatty liver. Which test is considered the gold standard for diagnosing NASH? Answer C. Liver biopsy. While imaging and blood tests are useful, a biopsy remains the most accurate way to distinguish NASH from simple fatty liver. What percentage of weight loss is linked to NASH resolution? Answer C. 7 to 10%. Studies show that losing 7 to 10% of body weight can significantly reduce liver inflammation and improve fibrosis. What is the leading cause of death in patients with NAFLD? Answer: Option C, cardiovascular disease. Surprisingly, most people with NAFLD don't die from liver failure. They die from heart-related conditions. That's why treating fatty liver is about more than just liver. Which medication has shown benefit for non-diabetic NASH patients? Answer: Option B, that is vitamin E. Studies suggest that 800 IU a day of vitamin E can improve liver health in non-diabetic NASH patients. However, it should be used cautiously in those with heart disease. Case study: Early NAFLD. Meet John, a 42-year-old man diagnosed with early-stage NAFLD. His doctor advised diet changes, exercise, and weight loss. After 6 months, he lost 8% of his body weight, his liver enzymes normalized, and his ultrasound showed less fat buildup. His journey proves that small changes lead to big results. Case study: NASH with fibrosis. Now meet Sarah, a 56-year-old woman with NASH and fibrosis. Along with lifestyle changes, she started vitamin E and pioglitazone. At her 12-month follow-up, her liver biopsy showed less inflammation and no progression of fibrosis. Early intervention matters. Case study: Advanced cirrhosis. And then there's Michael, a 62-year-old with NASH cirrhosis. He developed ascites and mild encephalopathy and was placed on a liver transplant waitlist. While he managed complications with medications and dietary changes, his condition eventually required a transplant. For some, early diagnosis can prevent this outcome. Advanced diagnostics for fatty liver. Goodbye, painful biopsies. Hello, advanced diagnostics. New imaging techniques like MRI, PDFF, and FibroScan can accurately measure liver fat and stiffness without invasive procedures. The future of diagnosing fatty liver is faster, easier, and pain-free. Your liver is an incredible organ, capable of healing itself if given the right care. The key to reversing fatty liver? Early action, healthy habits, and consistency. Remember, a healthier liver means a healthier, longer life. Take charge of your health today. So where do you go from here? Start small but strong. Eliminate processed sugars, eat more whole foods, move your body daily, and stay proactive about your liver health. Your liver is your lifeline. Treat it well, and it will take care of you. Thank you for joining this journey to better liver health. Remember, knowledge is power, but action is transformation. Start making small, lasting changes today. Your future self will thank you.